Imagine being the best player in your sport, then getting injured for a whole year. Then there's this new athlete comes along and starts getting the buzz that they're the best athlete while you're injured, and you start feeling forgotten. Then someone comes up to you and tells you, hey, you can take antibiotic steroids and it'll make you heal faster and make you stronger. Would you take them? Hello class, I'm Mike Browning, and I'm going to tell you about what steroids are, what they do to your body, and some of their side effects. Let's begin with what antibiotic steroids are. Here I have a photo of what they are. This is the liquid form, and this is a pill form. But according to the website alcoholism.about.com/steroids, antibiotic steroids is the familiar name for synthetic substances related to the male sex hormone. They promote growth in skeletal muscle and the development of male sexual characteristics, and also have some other side effects. Antibiotic steroids were first developed in the late 1930s, primarily to treat a condition in which the testes do not produce significant testosterone for normal growth, development, and sexual functioning. The primary medical uses of these compounds are to treat delayed puberty and some types of impotence and wasting of the body caused by HIV and other diseases. During the late 1930s also, scientists discovered that antibiotic steroids could facilitate the growth of skeletal muscles in laboratory animals, which led to the first uses by bodybuilders, then weightlifters, and then by athletes in other sports. Now that I have explained to you what antibiotic steroids are, I'm going to tell you what they can do to your body. Here I have a photo of a before and after, and as you can see, in the before he wasn't that big, and then 4 weeks later he got pretty swole. But according to the website menshealth.about.com, antibiotic steroids are used because of their ability to improve performance by increasing muscle mass and decreasing body fat. So their use depends on the type of sport you're playing. It is also believed that antibiotic steroids is used in widespread competition, especially in bodybuilding. Steroid use is illegal, and athletes are tested year-round to see if they get caught to prevent unfair advantages. And they're also used by men to shape their bodies, as you saw in my photo right there. Also, according to the website NCBI, most scientific studies of steroid use by healthy males athletes that have used antibiotic steroids is that they use substantially lower dosage than many other athletes. Analysts of these studies suggest that persons will gain an average of 2.2 kilograms of lean body weight during steroid admission, but that there exists great individual differences in strength changes induced by steroids. Approximately 50% of investigations show significant improvements in strength, but they show no great deal when it comes to dealing with cardio. Now that I've explained to you all about what they do to your body, let's see what some of their side effects are. And as you can see in this photo, the side effects go to all kind of regions of the body between male and female. I mean, they're all over the place on this person. But according to the website www.drugabuse.gov, steroid abuse may lead to serious and even irreversible health conditions. Some of the most dangerous consequences that have been linked to steroid abuse include kidney impairment or fatigue, damage to the liver, and cardiovascular problems including enlargement of the heart, high blood pressure, and changes in blood cholesterol, leading to increased risk of stroke and heart attack. Steroid use commonly causes severe acne and fluid retention, as well as several side effects that are gender and age specific. For men, they can cause shrinkage of the testes, reduced sperm count, baldness, development of breast, and increased risk of prostate cancer. For females, growth of facial hair, male pattern baldness, changes to the menstrual cycle, enlargement of the clitoris, and a deeper voice. And for children, they can stunt the growth, accelerate puberty, and then they also might not get their height expected if steroid use is used in typical adolescence. So now you see some of the side effects that come along with steroid use. Let's recap. I've talked to you all about what anabolic steroids are. They're basically a synthetic form of male hormones. Also, what they do to your body, they increase your size, make you faster, make you a better athlete. I've also given you some of their side effects, like how they can damage your liver. So with all this information I provided you all, going back to the beginning, if you were that athlete that got injured, and would you take antibiotic steroids if it can get you back on the field? I hope I've given you all a little better understanding of what antibiotic steroids are.